Lately, a lot of our patients have been coming to us with complaints about stress, jaw problems, neck problems, difficulty chewing, pain, that type of thing. When they come in, we do a complete evaluation to try and figure out what the root of their problem is, instead of just making a bite appliance or something like that. So very, very important to follow a sequence of evaluations to get to the answer to what the root cause is. So we do a full evaluation of our patient. We palpate all the muscles to try and see which ones the patient's having discomfort with, because that's going to give us a lot of information. We measure how far they can open. That's important too. We use a stethoscope and listen to their joints for any popping, clicking, or crunchy sounds. We're going to use a grid like this to evaluate the patient's shoulder posture, their head tilt. All right? We're even going to do a video of them walking to check their gait, to see if they have an uneven gait. The fascia connects our whole body together. So our jaw, our skull, pelvis, and then even down to the feet are all connected by fascia. So we need to know all that information when we develop a treatment plan for the patient. Okay, we're going to be looking for head forward posture also. So we have the patient turn and face the wall. All right, and we look at the position of their head in alignment to the rest of their body. Patients with airway issues may have a head forward posture because they're doing that to try and improve their breathing. So this is also important information to know. So once we've decided exactly what the patient's problem is, we're going to be using infrared lasers with a handpiece similar to this to treat the areas where the patient is having discomfort. It may be over individual muscles, it may be muscle groups that we're treating, and the patient's going to feel a warm sensation when this is being done. We're releasing the fascia, reducing inflammation, improving the lymphatic drainage in the area too that may have been constricted, because when muscles spasm or fascia is constricted, it affects the flow of the lymphatics, and that's very important too. All right. So once we've treated the patient, sometimes one treatment is sufficient, sometimes multiple treatments are necessary, but every person is an individual issue that they present with, so we treat them very differently because of that. If you think that these are problems that you may be having, just give us a call and we'd be more than happy to evaluate you and try and help you feel better.